Good morning, everyone, and welcome to World Bank Live. I'm Srimati Sridhar here in Washington, D.C. And over the next half hour or so, we've got a great conversation for you lined up on the impact of the COVID-19 pandemic on cities and urban life. Now, we're going to be talking about things like what puts cities at risk during a crisis, what makes some cities more resilient than others when it comes to fighting crises, and how has social isolation changed cities that were once thriving, and how has that impacted the economy at large? Now, the consequences are very much real. And to talk about all this and more, I'm delighted to have with me Same Waba. He is the Global Director for Urban Disaster Risk Management, Resilience and Land here at the World Bank. Same, welcome.
Welcome. Thank you, Shri.
So Same, let's get right to it. This topic of cities and resilience is very much relevant right now as this pandemic surges. But before we delve in too deep, let's unpack this a little bit. Take me back to the basics here. The virus aside, how do cities factor into economic development and why do they matter?
Thanks, Shri. So the world today is urbanizing at a very fast pace. We're talking about 2.5 billion new people who will be moving to cities by 2050, which is equivalent basically to adding one turkey per year, every year to cities. We know that urbanization and poverty alleviation go hand in hand. No country has reached a middle income status without urbanizing, and no country has moved on to upper income status without having vibrant cities. Now, cities bring people, capital, and ideas in the same place. It results in gains in productivity because of this agglomeration effect. It also results in a lot of innovation and knowledge exchange when people come together. So that's, if you will, the plus side of urbanization. But there are also downsides. When urbanization is not managed well, people end up in informal settlements and slums, in housing conditions that are poor, or housing is unaffordable. There's crime and violence, there's pollution, there's congestion. So in order for urbanization to produce the plus side of poverty alleviation and not produce the downside, this urbanization has to be managed well, meaning governments will need to plan in advance for this population growth, provide the services, the infrastructure, the housing in advance, instead of people moving into cities and then slums growing, and then government has to go after the fact to try to fix it at a much higher cost.
So Same, you mentioned here sort of the pluses and the minuses to cities urbanizing so rapidly. So if we tie that in now to the crisis going on right now, around the world, governments are telling their citizens, especially in densely populated cities, to practice social distancing and like measures. What effect is that having on cities?
So COVID-19 is having a devastating effect on cities, which are totally in the front line. I mean, cities find themselves having to do three things. One is to do all their efforts to stop the virus transmitted from one person to the other. So they need to put in place lots of policies to close businesses, to reduce public transport, to close schools, and to do all efforts to reduce the transmission of the disease and to enforce, of course, the social distancing. At the same time, they have to care for all those who are affected. I mean, there are those who are affected from a health perspective, and also those who are affected from an income and livelihoods perspective. I mean, these are people working in the informal sector whose livelihoods are affected by confinement and social distancing, and cities have to help with cash transfers, with food distribution, and so on and so forth. Lastly, cities need to continue running essential services at the very least for the population. It's waste management, it's policing, it's ensuring that the food gets to market, etc. Now, lastly, and that's the biggest compounding factor, cities have to do all that and scale up their action at a time when economic activities are contracting, and as a result, cities' revenues are also shrinking. So we've done some analysis on some cities, and their budgets are shrinking or expected to shrink next year by anywhere between 15 to 25%.
So, clearly there is a lot that cities need to do, and it's not always easy. But if we now talk about the developing world, speaking of social distancing and like measures, is it more difficult for developing countries to employ these kinds of measures?
It is definitely more difficult. I mean, in if you will, in the developed world, I mean, maybe confinement and social distancing might be easier to bear for the population because, you've got
Right.
decent housing, you've got infrastructure, broadband connectivity, you can telework, you can do online schooling, you have got services like food delivery, etc. It's not to say it's easy, but at the same time, the conditions might make it more bearable if you want. On the other hand, in the developing world, and especially when you're talking about slums and informal settlements, housing conditions are poor. People are overcrowded in housing. The infrastructure is lacking, especially water and sanitation. There's no broadband connectivity. I mean, children are particularly affected with neither schooling nor nutrition because it tends to be the healthiest meal children might eat in a day. And overall, the population is much worse off. So the impact in the developing world is obviously much more exacerbated. And we haven't reached the peak yet.
Right. Now, speaking of some of these impacts, are there certain indicators or factors that cities can look out for that, can let them know that they could be a potential hotspot for contamination where the virus is concerned?
Definitely. So one of the pieces of work that we've done at the World Bank was to look, a colleague of mine, Shomik Lal, to look at cities, and we are gathering information about the overall city, so satellite imagery, together with a three-dimensional configuration of the city, as well as the information about the population density and how it's distributed into a city. And by putting this together, we can figure out which place social distancing might be impractical, meaning like the places where the population density does not allow people to keep them apart from each other. And then you add the infrastructure, especially places like communal water taps or public toilets, which increase the risk of contagion. So when we add this analysis, we have developed a rapid assessment methodology that allows us to identify where could be the hotspots. And with this tool, which we've piloted in 3 cities, in Cairo, in Mumbai, and in Kinshasa, we can tell mayors where to target their limited resources in contagion hotspots to try to reduce the risk of transmission. And we're working on this to scale it up to a much larger group of cities, and we're working with Slum Dwellers International in the process.
Great. So Same, hold on to that thought. I want to, get to that a little bit more. But first, I just want to take a quick break and welcome those of you online who have been listening in. If you're just joining us, welcome to World Bank Live. We are here discussing the impact of the coronavirus pandemic on cities with our guest, Same Waba. He is the Global Director for Urban Disaster Risk Management, Resilience, and Land at the World Bank. And we see a lot of new folks tuning in from all over the world. We've got Willie in Cameroon, Sawan in India, Tomei in Indonesia, Karen in Peru, Amir in Pakistan, Maria in Guatemala, and Farid in Afghanistan. Guys, welcome. It's so great to have you here. Thanks so much for being here with us. And, now, Same, we've so far laid the groundwork for cities and some of the concerns. But let's continue to dig a little bit deeper into some of the more specific issues that we may see arising. Now, we talked about this a little bit earlier before the break in terms of the developing world, but many parts of the global south have yet to hit their peak when it comes to the virus. And this is where I'm thinking about slums and these informal settlements. How does that concern you as we go forward?
It is a very concerning situation in settlements in the developing world. The conditions living conditions are poor. We're talking about overcrowded housing of poor quality, lack of infrastructure. We're talking about lack of services, lack of broadband connectivity. We're talking also about a large majority of the population with employment in the informal sector, with irregular incomes, without savings, and with major challenges in terms of living from hand to mouth. So enforcing social distancing and confinement means for a large population in the developing world would mean hunger. So the trade-off here is between hunger and disease. So that in Nairobi or in some of the townships in Johannesburg or elsewhere, we're seeing, violence flaring up. We also know that there are places like refugee camps or places where migrant labor might concentrate, which would suffer from additional disadvantages, such as, prejudice. So that's why we're very concerned, because the virus is yet to hit its peak on top of that.
Perfect. So, Same, we've laid out, some of the problems now, and I want to get to solutions. But before we talk about the bank-specific work in responding to COVID-19, let's think about things in the abstract for a minute here. What do you think needs to be done to stave off a crisis for some of the areas that you've been mentioning just now?
So we would need to be helping cities in 3 phases. The first is the emergency phase. And in this regard, you need to help cities in putting together the measures that are needed to flatten the curve, to reduce the transmission so you don't overwhelm the medical systems. These are things that include the policies in terms of closure of systems like schooling systems, non-essential businesses, closing them, whether they're public or private facilities, canceling events, reducing public transit, and putting in place at the same time the measures that are needed to keep the city running, at least emergency services like policing, like waste management, like ensuring that food gets to market, ensuring that the online education system is working. And finally, cities in that emergency phase have to care for those that are affected, both the health affected and the economically affected, those whose livelihoods, because they work in the informal sector, because they need to stay at home, are without income or livelihoods. And here you need food distribution, you need cash transfers, etc. That's the first phase. The second phase is building up for the early recovery. And that means also, because of the impact on livelihoods, how cities will start, being part of the implementation of the stimulus package that would be in place, how they would create employment opportunities for the poor and the vulnerable, ensuring, for instance, labor-intensive public works, construction jobs, maintenance jobs, drainage of, waste collection, etc. But basically injecting lots of jobs into the system so that you can help with the livelihoods. And as I mentioned, those 2 things need to happen while cities have shrinking revenues, because their tax revenues, etc., the decline in economic activities. Lastly, we're going to have to help cities, prepare for the new normal. Now, the new normal is going to include things like rethinking public spaces, the need to improve infrastructure and housing in slums and informal settlements, which are contagion hotspots, but also needing to think about how do you manage places like live animal markets, wet abattoirs, where such pandemics often emerge. How will you think about mobility and introducing, cycling and walking and transforming? And then lastly, you want to help also the cities better prepare for such emergencies, preparing themselves and developing the response capacity.
Absolutely. And, I think this new normal is something we're all thinking about right now. So let's keep talking about solutions. But first, just another quick welcome to folks who may have just joined us. Thanks so much for being here with us, everyone. We're so happy to have you here. We're talking to Same Waba. He is the World Bank's Global Director for Urban Disaster Risk Management, Resilience, and Land. And we're discussing the impact of the coronavirus pandemic for cities and their inhabitants. Now, at this break, we have Jessica in Spain. We've got Tawa in Tanzania, Regina in Brazil, Queen in California, Derek in South Africa, and Sandeep in Nepal. Hi, guys. It's great to see you here. Thanks for joining us. Same, let's keep this going now. We've talked about some facts where cities are concerned, some of the risks. Now let's talk solutions. You and your colleague Somik Lal wrote a blog, which you mentioned earlier in the conversation, that folks can go read. It's on our World Bank blogs channel. And in that, you write that the bank has developed a way for leaders to identify at-risk areas so that they can get the resources that they need. Can you tell us a little bit more about this?
Excellent, Shri. So this is a rapid assessment methodology to detect and predict what could be hotspots for contagion and viral transmission in cities. So we start by bringing together high-resolution satellite imagery, three-dimensional modeling of the city to basically infer what is the built-up area in the city, the amount of floor space. And then we add population density and the way it's spatially distributed across the city. When you add these variables together, you can figure out within a city which neighborhoods would not be conducive to social distancing, which is basically keeping people 2 meters apart. So you take the number of people in a given area on the built-up area in a given neighborhood, and either it allows or doesn't allow for social distancing. Now, you also know that there are other factors that contribute to contagion. For instance, when water taps are communal, when toilets are public toilets in a given neighborhoods, these increase the contagion risk. So by looking at the state of infrastructure and looking at the building, you can figure out which places within a city are more likely than not to be contagion hotspots. With this information, which we piloted in 3 cities, Cairo, Kinshasa, and Mumbai, you can basically tell the mayor, focus your resources on these neighborhoods. These are the neighborhoods that need additional water supply points, that need additional toilets, that need, sanitation and hygiene campaigns, that need interventions, that might have more vulnerable population, so that mayors can have, a rapid intervention to reduce the transmission of the crisis. So we're gearing up to scale up this work, and we're doing it not just with technology, but we're doing it on the ground with Slum Dwellers International. So it's bringing both the technology and the teams on the ground to be able to predict rapidly where could these hotspots be.
That's fantastic. Speaking of scaling up, I want to bring this back to the World Bank. For folks at home who might not be aware, right now the World Bank is making up to $160 billion available over the next 15 months to help fight this pandemic. So, Same, give me briefly some of the highlights for what the urban development team is doing in their, in this fight to the response.
So we, at the World Bank, the first analysis is predicting that as much as 100 million people will be the new poor as caused by this epidemic. And the new poor are going to be mostly in cities, which are heavily impacted. So from an urban development perspective, the main focus needs to be about targeting those poor and the vulnerable with quick interventions. These interventions include, at the very first level, cash transfers, food distribution, support on, water and sanitation, etc., to ensure that in a context of social distancing and confinement, they are not negatively affected, that you can, compensate for the disrupted livelihoods. Because for the large part, they work in the informal sector, they have irregular incomes, they live hand to mouth. So you need to intervene quickly to support the poor and the vulnerable. You need to intervene quickly also to support children with nutrition, because, with schools closed, schools are not just for learning, but they're also for nutrition for the kids. So all these interventions need to happen in a very first place. Now, sometimes you have in certain countries, in certain cities, social protection systems that work. You have information on who are the poor, where do they live, you can target them directly. That would be great. But in many places, you don't have that information. So your next best solution is to go and do basically a place-based approach to find the places where the poor are likely to live and concentrate, and provide your intervention in there. And that's why we're scaling up our slum upgrading and informal settlement upgrading programs, because they tend to have a majority of the poor and the vulnerable. At the same time, you want to also help support local governments, because cities with declining budgets, with increasing responsibilities in this crisis, need to deliver services, need to provide grants to communities, to the poor, but at the same time, they're having less resources as a result of the economic crisis. So all that package of support needs to be put in place. Now, how do we implement rapidly? First, you start by restructuring the existing portfolio. Projects that are out there, that are having money that is unspent, you start thinking about redeploying these fundings towards the new priorities. You also start thinking about additional financing for existing operations. And the reason to rely on existing projects is because they already have an implementation infrastructure on the ground. Now, this doesn't mean you do things the same way you did it before. You'll do things differently, because in a crisis like this, you have to think in a very different way. You work with social enterprises, with community-based organizations to do these types of distribution of cash and food, and to be able to start injecting also labor-intensive public works, cash for work type programs that basically create employment opportunities that are semi-skilled or unskilled, so that there is revenues and livelihoods that are reconstructed in the places where livelihoods got decimated by the crisis. Lastly, with our disaster risk management team, we're also working on strengthening basically the disaster and pandemic preparedness and response capacity of cities. So when these types of emergencies appear, they're prepared in terms of financial preparation, having a fund for the rainy day, in terms of having plans for business continuity, having plans on redeploying their human resources from the non-essential services to the front line, and so on and so forth.
Great. So, Same, as we start to wind down this program, I want to look over the longer term. And you mentioned this in your answer about how intervention is very key. But I want to know, what lessons are we learning right now, and what lessons are we going to learn over the coming months that are going to help us better respond to just future crises in general?
So I think we're learning 3 lessons. The first is about the places that are more likely to get hit by a pandemic are not just the larger cities or the places with higher population density. They are the places where this density was poorly managed. That means it's the places with housing in substandard conditions, with poor infrastructure, and where the vulnerability of the population is prevalent. So we need to focus on these places. We need to focus on the places that don't have public spaces, and improve living conditions out there and infrastructure conditions and the livelihoods in order to avoid such crises. The second lesson is really about the people who are most affected. And that's a combination of the poor and the vulnerable, who are workers in the informal settlement, in the informal sector with irregular incomes. There are the people with prior medical conditions, the disabled, the elderly, and of course, the children. So we need to focus interventions on ensuring that the impact on the poor and the vulnerable are mitigated. And lastly, we know that cities are in the front line, but we know also that their capacity is stretched, their resources are thin, and they need to be strengthened. So working on strengthening cities' capacity and preparedness for these crises are going to be critical in the way we confront the next epidemic or disaster.
So, Same, these are 3 really great lessons to learn and just take in. And, let's end on a high note here. What's giving you hope right now?
So there's a lot that's been said about how, COVID-19 is going to lead to the demise of cities. Now, I'm confident that cities will come out of this crisis stronger and better than ever before, because the lessons that we've learned is that a pandemic like COVID-19 spares no one, rich and poor, irrespective of whom you are likely to basically get in the negative impact. And therefore, investing in the places that have lacked infrastructure, that have lacked good housing conditions, investing in the people whose livelihoods are precarious is going to be critical for us to not only have an inclusive city, but also ensure that these types of pandemics and disasters, leave no one behind or no one affected. So I think there will be some trends that will accelerate. So the way we use technology, whether it's for working, telework, or for learning, online education, or for shopping, I mean, these trends will accelerate. But what will really make cities the vibrant places that they are is, number one, investing into making sure that no place is left behind within a city. And number two, ensuring that cities are livable. And by livable, I mean, they've got parks, they've got open spaces, they've got culture, they've got amenities, they've got diversity, inclusion, high quality education and services. Because in the future, I mean, if you're able to basically telework, if you're able to live somewhere else and work in a different place, what will really make a city thrive will be the livability and the amenity and the diversity and inclusion. But it has to be an inclusive city for all. So that's why I'm hopeful for the future.
Absolutely. Well, Same, on that inspiring note, I want to thank you so much for joining me here this morning on World Bank Live to talk about cities and the coronavirus pandemic. It is uplifting to hear from you that we will get out of this. And thank you again so much for being here with me this morning. Folks, we are out of time. Thank you for joining us. And to learn more about what the World Bank is doing in response to the COVID-19 pandemic, you can always go to our website. It is worldbank.org/coronavirus. And remember, the conversation doesn't stop there. You can go to our World Bank Live channel where you can catch a recap of all of our coronavirus-related discussions. We talk social protection and jobs, remittances and education, and so much more. So head on over to live.worldbank.org for all of that. Now, with that, I want to thank you guys again so much for being here with us this morning. Stay healthy, stay safe, and we'll see you next time. Bye-bye.